Welcome to our comprehensive guide on autism treatment. You know, when I was diagnosed with autism as a child, there wasn't much known about it. People thought kids like me were just difficult. But we're not difficult, we're just different. Thankfully, today, we know so much more. Today, we'll explore various aspects of treating autism, from types of treatments to home care tips. We'll look at what works, what doesn't, and what you can do to help a loved one on the spectrum. There are many different ways to help people with autism. Think of it like a toolbox. You wouldn't use a hammer for every job, right? Some folks benefit from behavioral therapy like ABA, which breaks down skills into smaller steps. Others might need speech therapy to help them communicate or occupational therapy to improve their sensory processing. Sometimes medication can be helpful for things like anxiety or focus, but it's not a one-size-fits-all solution. It's crucial to work with a qualified professional to find the right tools for each individual. Treating autism isn't about fixing someone, it's about understanding their unique challenges and strengths, and creating a plan that empowers them to thrive. Just like everyone else, people with autism have their own personalities, likes, and dislikes. That's why a good treatment plan is tailored to the individual. It's about working with a team of professionals, including doctors, therapists, and educators, to create a roadmap for success. Early signs of autism can be subtle. Maybe a child isn't talking as much as their peers, or they're overly sensitive to certain sounds or textures. Maybe they have repetitive behaviors like flapping their hands or lining up toys. If you notice anything unusual in your child's development, don't wait. Talk to your pediatrician. The earlier autism is diagnosed, the sooner intervention can begin. When it comes to autism, early intervention is key. The younger a child is when they start therapy, the better their outcomes tend to be. Think of it like learning a new language. It's easier to become fluent when you're young. That's why it's recommended to start treatment as soon as an autism diagnosis is made, ideally in the toddler years. Chapter 5. How to care for an autistic child at home. Caring for an autistic child at home can be both rewarding and challenging. It's important to create a structured and predictable environment. Visual schedules and clear routines can work wonders. Remember, sensory sensitivities are common in autism. Try to minimize overwhelming noises and bright lights. And be patient. Communication can be tricky, so try to understand your child's nonverbal cues. Most importantly, focus on their strengths and celebrate their progress. Chapter 6. Complementary therapies for autism. Now let's talk about complementary therapies. These are things like dietary changes, supplements, or alternative treatments. While they're not a replacement for traditional therapies, they can be helpful for some individuals. For instance, some families find that a gluten-free diet helps manage their child's symptoms. But remember, it's essential to talk to your doctor before making any significant dietary changes. Chapter 7. Does autism have a cure? This is a question I get asked a lot. And the truth is, autism isn't a disease that you can just cure. It's a different way of thinking and being in the world. But that doesn't mean there's no hope. With the right support and interventions, people with autism can live full and meaningful lives. Research is constantly evolving and new treatments are always being explored. Never give up hope. Outro: Understanding Autism, a lifelong journey. Thank you for joining us in this informative session on autism treatment. Remember, early intervention and a tailored approach can make a significant difference. Stay informed and support your loved ones with the best care possible. And to those on the spectrum, I say this: the world needs your unique talents and perspectives. Don't be afraid to be yourself.